Buenos días. Good morning.
Good morning.
We still need more coffee. I'm going to take a few minutes not only to introduce Dr. Kim Muser, but also to just give a backdrop to today's institute. Well, we're certainly, the county is very pleased to be able to co-host this institute for Professor Maria Sardinas. The impetus for today has somewhat of a brief history in the scheme of time. As you know, or some of you may know, we studied the transition from a medical model system of care in adult and older adult in health services about 8, 9, 10 years ago with a system redesigned that you may or may not recall because you probably were not here, some of you. You were barely just graduating out of the School of Social Work or some other school here in town. During those 10 years, before I even continue, I see a known figure. Why don't you come to the front? Here's your table, Dr. Anita Harder. I'm sorry, Dr. Crow. Arita Crow. Some of you may not know that Dr. Crow was our previous mental health director here in San Diego County. Welcome to our institute today. Great. Okay, so in the last 10 years, we have been able to move the system towards a recovery and rehabilitation model. Nowadays, we use more of a transformation word to say what we have done in the last 2 to 3 years with the Mental Health Services Act. But certainly, I want to note a couple of the things that you all have participated at different levels. You know, we have great entities and agencies here in San Diego that have really taken up the task of practicing not only the philosophy, but really incorporating and integrating these practices in recovery practice in the program. For example, the Community Research Foundation, very well-known entity here that has created for us the alternative to psychiatric hospitalizations, known best practice. And today is about talking about evidence-based practices, or as Dr. Muser refers to, practices based on evidence, which is a term that he used yesterday when we met with him, and I like that term. So START programs are best practices. Certainly the Debbie Malcarde, who has been our PSR, Psychosocial Rehab Coordinator for Mental Health Services, among other things, have really introduced the Wellness Recovery Action Plan, the Roadmap to Recovery, really has pursued other practices such as intentional care to be integrated in the program. Our clubhouses that some of you participate and attend and operate have also incorporated elements of employment and supportive employment as well as skills development. I think the other big initiative that one of my staff has really taken upon herself to continue, Virginia West, is the dual diagnosis, co-occurring disorders, primary, actually mental health and substance abuse. She has taken the leadership in integrating those interventions in the last couple of years, and also including the older adult initiative we have. So as you can see over the last 10 years, more and more we move toward those recovery practices and interventions that really provide for our clients a support service and not just a treatment model of interventions, but more of a fulfilling, holistic approach to the client. So today's presentations throughout the day, you will be seeing what we would like here in San Diego to begin to consider. Did the mic just go off? So the assertive community treatment is another evidence practice that we have here in our full service partnership programs. We're going to be looking at where do we go now from where we are. And certainly one of the things that I was talking to Dr. Muser yesterday is how do you know when you have arrived? How do you know that you got where you are is where you want to be? And certainly outcomes is an area that I still feel that we need to develop further, or actually really begin to develop in a simple way that makes sense for the client and for the programs. We also need to further the integration across the system and in a coordinated fashion, and also the training and education piece of recovery I think is very key in terms of next steps. So today you have several areas of focus, and I'm also very glad to say that the social skills piece and the functional adaptation piece are based on research that we're also conducting here in San Diego with UCSD, so I'm very pleased to have that as part of our presentation today. Dr. Kim Muser, well, I met the gentleman yesterday for the first time, although I have read some of his work in the past years. A fantastic man, very intelligent, very sensitive, and very accommodating to our questions that we bombarded him with him yesterday at our staff meetings. Dr. Muser is a licensed clinical psychologist and a professor in the Department of Psychiatry and Community and Family Medicine at Dartmouth Medical School in Hanover, New Hampshire. His clinical and research interests include psychiatric rehabilitation for persons with severe mental illness, intervention for co-occurring psychiatric and substance use disorders, and the treatment of post-traumatic stress disorder. Incredible, fascinating stuff that he was talking to us about that yesterday, and how this is a core interest nowadays in terms of research and investigations. Dr. Muser has served as a board member of NAMI, New Hampshire, and has strong commitment to educating the public and mental health professionals about mental illness. He has given various lectures both nationally and internationally, and has published over 10 books for clinicians and family members, and has written hundreds of articles for professional journals on the topic of recovery. In 2007, he received the Armin Love Award from the United States Psychiatric Rehabilitation Association for his contributions to research on the treatment of mental illness. Please welcome Dr. Kim Muser.